we're here for a very special reason. First, I'd just like to do some quick introductions for our panel here today. Everybody knows Ray. Ray, would you just kind of give us a little overview about who you are and your role at AAPC?
Sure. Yeah, I'm Ray Jimenez, Chief Product Officer here at AAPC. I've been a member of AAPC and in the healthcare for a very long time, longer than I've worked here, and look forward to talking more about our announcement today.
And then Dan Schwabach, who is more behind the scenes, world traveler. Dan, tell us a little bit about your role with AAPC.
Sure. I joined AAPC back in 2010, so it's been 13 years now. So I've worn a couple of hats over the course of being here at AAPC. Currently, I'm the Chief Business Development Officer. I also oversee all of our international business, so all the membership and things we do internationally, I help with that. So excited to be here and chat with you guys today.
Awesome. Now, just real quick for our audience, if you have questions as we discuss, feel free to leave those questions in the chat. We'll do our best to get to as many as we can. Lindsay Motter is asking, will this be recorded? Yes, this will live on the AAPC Facebook page, and I will also get this up on our YouTube channel and podcast later this week. So with that, Dan, would you kind of share why we are here today?
Sure. Yeah, obviously, as folks know from the announcement that went out this morning, AAPC's acquired a company called Semantic Health. Just a little background on that company. They're a Canadian-based company, and they specialize in doing artificial intelligence, particularly in the world of medical auditing and medical coding. So we've been working with that company for some time now, and the stars kind of aligned, and we were able to make an acquisition of that company. So maybe real quick, I'll just kind of mention kind of why we did the acquisition and what led to that. As folks know, one of our key missions at AAPC is certification and training of our members. Part of that mission is also that we are looking to provide tools and resources to our members and to organizations to help them in their job roles and to help, and navigate the complexities of the world of healthcare, particularly in revenue cycles. So, as part of that mission, we're always looking to, for solutions and things that we can offer to members to kind of help achieve some of those objectives. Over the last several years, we've actually made a number of acquisitions. Supercoder was one of the very first ones we did several years back, and that's now evolved into the Codified tool, which a lot of our members take advantage of and use. Another acquisition was related to Practicode, which, again, we use that internally for CPC training, and organizations use that for production training and skills assessments and those kind of things. Semantic in specifically, there were a couple of drivers as to what led to that acquisition. If I just kind of go back historically here for a second to give some context, we launched our client services group back in 2010, and that's one of the first things I kind of helped to spearhead when I came on board. And that client services team provides predominantly audit services, OIG compliance audits, revenue audits, CDI training, those kind of things. And it was a very manual process. We're using spreadsheets and other things for several years. And as that service offering grew and more members were taking advantage of that, we had to develop some tools. So we actually developed an in-house audit tool to help us manage that workflow. And over time, that morphed into even a SaaS-based product that we've offered to members. But the real impetus here around Semantic was this now allows us to, really expand our audit capabilities, and it's really infusing the tools that we have currently with more cutting-edge technology, particularly around AI and those kind of things. So it's really expanding our capabilities also into the inpatient side of things, because that's a key focus where Semantic is. So, a lot of what led to that acquisition was to help in terms of the expansion and increasing the capabilities of our client service offerings that we have.
Okay. AI has been such a huge topic, not only in healthcare, but globally for every industry over, especially the last year. I feel like since ChatGPT made their big push, I see comments and discussions about it in the AAPC Facebook group, and sometimes concern, sometimes members see how it can be embraced and work with professionals. Ray, could you share a little bit about how this will benefit our membership?
Yeah, I think with any role that we have, roles evolve over time, and that has a lot to do with what we have access to do our work. And with more sophisticated tools, it should help us gain efficiency, more accuracy. It should better enable our members to do their job. I know that anytime we talk about AI across all industries, like you said, Alex, the first thing that people think of is, well, what does this mean for me? And do I become obsolete? And is my job replaced? And I think that, embracing the technology, understanding the technology, learning how to use it is just another tool in your tool belt to help make you better. So we don't see this as a replacement of role, but we do see this as opportunity for evolution of the role and changing some of the things that we focus on, taking the easier things to do and make them more automated so that we can really focus on problem areas, more complexities, because let's face it, healthcare gets more complex every day, less simplified. So this is just a tool to help augment or assist them in their work. There's also great opportunity in helping train these models. As much as we have change that we have to continually educate ourselves, helping these tools learn for taking care of those less complex tasks is a job of its own. And then, when we talk about documentation, having more of a CDI element to get documentation clean on the front end, as well as there's always going to be a need for check and balance and auditing the results on the back end.
Okay. I don't see any specific questions yet from our audience, but if you do have them, audience, please feel free to drop them in the comments. I'm going to ask if you go ahead, Dan.
I was just going to add a couple of other thoughts to kind of what Ray had mentioned there, if that's okay.
Sure.
Yeah, one of the, from my perspective, one of the biggest challenges we have in healthcare right now is just data overload. And how do we manage that data in a meaningful way? We get data from the coding side of things, the clinical side, quality, population health management, remote monitoring. So it's just the amount of information coming into the healthcare system, especially as we've had, we've moved to more digitization, those kind of things. It's overwhelming. And one of the things that AI is particularly good at doing is taking that vast amount of data and information and analyzing that and then identifying actionable insights. So for coders, for example, you can take an inpatient record and it can be hundreds of pages long, right? So coders spend a lot of time hunting and pecking for information across all those different pieces of data that they have. So the AI tools are really good at, analyzing that quickly and then creating those actionable insights. So, things like maybe it can identify there's a missing diagnosis code or there's incomplete demographic information or issues with medical necessity, things like that. So I almost look at AI as more of a digital co-worker. What it ultimately does is it takes those repeatable mundane tasks that coders are doing and it speeds those processes up. So really what coders are now focusing on is kind of those higher order activities. So I see coders taking, they're spending time, they're going to be fixing those actionable insights that are produced by the AI tools. They're going to be validating AI generated recommendations. They're going to be, so the need to be able to work more complex cases and expand the scope of what coders feel comfortable, coding on different types of services, and then focusing more on how do you improve the input that goes into those tools. So it's really the clinical documentation and physician training. So, and a lot more time doing research and what's called prompt engineering. So how do you work with the tools to identify and get the information you need? So again, back to Ray's point, it's not going to replace coders, but it's certainly, their roles will change. And that's just a few examples of what I see or how I think, those roles are going to change as far as what coders are doing with that technology.
I think of this similar to EHR. When we implemented EHRs, there was a lot of concern about what that was going to mean for our jobs. And as a result of electronic health records, we've seen new roles emerge and more need for compliance measures to make sure that, the tools are only as good as those that use them and interact with them. So we've seen technology being implemented in our industry that have expanded, changed, and added new roles like medical scribes, for example, with the implementation of EHR. That really wasn't a job until that happened.
Okay. There are a few questions coming through. Mallory Leonard asks, what specific changes are coming? So, and I'm going to kind of build on Mallory's question. Will we see Semantic Health change their name to AAPC Semantic Health or Semantic Health powered by AAPC? Will and I'm loading in a couple more questions into this. So how will this affect membership, and when will they be able to see the product and how it can benefit them?
Ray, you want me to tackle a couple of those questions?
Yeah, you want to take that first? Yeah.
Yeah. So with Semantic in particular, right now, they have services that they provide in Canada, and then they have services that they provide in the US. And their core focus in the US is an audit tool. It does DRG validation. So that's kind of their core product. We have a roadmap, obviously, with that acquisition. We'll look to expand those audit capabilities beyond just DRG, and so it can also be used for other, payment validations, payment integrity. So we'll expand those capabilities. In terms of right now, it's a separate entity, and it will, for the foreseeable future, remain that way, so that they have the autonomy to operate and continue to develop. Be fast and nimble. They're more of a startup, and so we don't want to, take away from that. So there is separation there. Whether it's a AAPC tool powered by Semantic or it's a Semantic tool, we haven't worked through those details yet. But if I was a betting person, I'd say, at some point in time, it'll be an AAPC tool powered by Semantic. And there's other things that we hope to do with that in the future, like use some of the technology to enhance Codify's capabilities and some other things. So there's a lot kind of planned there. Alex, you had a couple other elements to that question, but.
Yes. Well, I feel like you covered that very well, Dan. Thank you. Kristen Owens says she's excited to read the email this morning regarding the acquisition. How is the tool to be used in conjunction with other encoder solutions like Codify?
Well, as far as, long-term roadmap, as Dan said, there's other features and things that they've already begun working on that they have as a priority. Long-term, we see the potential for this to be integrated with Codify to use those tools hand in hand, right? A code lookup tool with all of the research and all the information that is powerful in Codify already, along with an automated tool that you can utilize. So we do see a lot of synergies there. And we know that the Codify product is going to have to evolve over time to stay up to pace with what people need in order to do their roles. So that's kind of how we're thinking about things long term.
Okay, great. Kim Joanne asks, what can we do if we're interested in becoming more involved with the AI? I've seen a subject matter expert at a tech company, or I've been a subject matter expert at a tech company, and have AAPC credentials. Would you guys have any recommendations to someone who wants to take a deep dive into healthcare AI, especially within our industry?
Yeah.
Where would you go?
Go ahead. You want to start, Dan, and I'll finish it up.
Yeah, I mean, a couple of things just within the industry itself, because it is somewhat new, right? As we talk with a lot of organizations, a lot of them are just in the early phases of trying to figure out what the use cases even look like for some of this technology. So, a good starting point is there's so many webinars and things going on out there right now. And that's part of, I didn't know much about AI up until, 6 months ago. As we started getting more serious about the semantic acquisition, I've had to educate myself there. But so there's a lot of resources and webinars and a lot of discussion around that. So I think a key first starting point is, just start to get up to speed on how the technology works and what it does. But, I think internally within your own organization, the more you understand that, again, every organization is going to be different, but figuring out how you can involve yourself internally with identifying use cases and those kind of things. And then AAPC as an organization, we're even still looking at, okay, how do we get more up to speed and involved in understanding the technology? And so I think there will certainly be opportunities for us to have user groups and other things where we're utilizing members to help give us feedback. One of the things, honestly, that I'm most excited about with the semantic acquisition is it gives us the ability to look at, to use this technology firsthand, so that we're really able to kind of see how it's affecting the industry, practical applications of that, and then how that would ultimately kind of translate to, for our members. So as we get exposure to that, we can understand how the technology is evolving. In that real world context gives us a better insight into what kind of training do members need, what kind of skills development do they need. So as we're using that technology, we become more intimately familiar with the subject. But I think we'll utilize a lot of members to help continue to grow those insights and understand, how the industry is evolving and what we need to do to help members prepare and take advantage of those tools.
Yeah, one thing I would recommend for the member, Alex, that asked that question is, a lot of people don't, because they haven't had the firsthand experience that this particular member did with working with technology, learning how it works, how she assisted in the process. This is really good information. I mean, I think that's one of the things that's very powerful about AAPC as a network, is being able to share our knowledge and our own experiences. I would encourage her to write articles for HBM about her own personal path and what she has been able to contribute. Speak about these things through local chapters. Local chapters love having new topics to talk about. This would be one of them. We're going to be expanding the knowledge and the education that we share with members through webinars, workshops, conferences. So I would say, right now, those are the most immediate ways that she could help contribute the knowledge that she already has.
I love that. LaShanta says this is a career field that you have to be committed to continuous learning and learning to pivot. This has been the way it has been forever, constant changes and being able to adapt. Everett Harvey has a great question that piggybacks a lot about getting more information, being more involved. He's asking, what would a role be for someone like me getting CPC certified and currently working in data annotation for AI training? I don't know if you guys have seen any AI related roles in healthcare in the revenue cycle.
Well, one thing I will say is that's been consistent in a lot of the vendors that we've all spent time looking at and talking to is they have a team of coders that are helping them with the validation and with the development. So someone with the background of understanding those analytics as well as understanding coding, I think that there's tremendous opportunity for them long-term in this field, especially, pairing those two skills together, I think is very powerful for them.
Okay. All right. Jennifer's asking, how would we sign up for a user group? I don't think we're at that stage yet.
Well, the best way to do this, Alex, is, if those of you that have been involved, whenever we're launching new products and in product development, we will send messages out to members that fit a certain demographic, right? In a certain role, have tagged themselves a certain way, and the profiling information that you fill out on the AAPC membership side. So what I would encourage you to do is, if you are interested in things like this, make sure your profile is up to date, current work, current things that you're doing. Make sure that you've opted into emails. The quickest way for us to get this type of information out is through email. So when we start looking for user groups and focus groups and beta testers, we're going to do it through Facebook Live posts like this, as well as through member newsletters and emails based on how you have communicated who you are to us through your membership profile.
I'm seeing several comments from members looking to contribute, being a part of this evolution, which excites me. And I know on my end, I don't hesitate. When we have a need, I will often post in the Facebook group and reach out to members who express an interest in that. So I love that. There's a great question by Ryan. He asks, and this, I think this would be a great question for Dan. What was special about Semantic that led AAPC to invest in them?
Yeah, great question. You know, in all honesty, we've looked at a lot of different technologies out there, and vendors come to us all the time and ask us to kind of assess what they're doing and give endorsements and those kind of things. So we get a lot of organizations that reach out to us, and we've spent a lot of time actually meeting with them and you know, evaluating their technology, because it helps to educate us. So we've seen a lot of what's out there. What was Semantic's a couple things. First off, the group of developers, that's a physician CEO. He's a physician that was a data scientist and just found that he loved his passion more for that side of things. And so it was somebody who really truly understands healthcare and the complexities of healthcare is kind of a first starting point. But the workflow of the tool and how it operates is so simplistic and just very well done. So we were very impressed with the workflow. We've been very impressed with its accuracy and results, more so than a lot of other technologies that we'd seen. And then culturally, it was a very good fit with how AAPC thinks and their vision of healthcare, and, you know, their interest in members and coders. So it was just a good fit from a culture standpoint, as well as just very impressed with their technology. And they're very cutting edge in terms of the use of AI. So they're much more advanced than a lot of the other companies out there, frankly. AI is evolving quickly. Something, you know, even 6 months ago can be outdated pretty fast. But those were some of the key things. And Ray, you looked at some of their technology. Maybe you can even speak to it from a more technical standpoint. But
yeah, we really liked their approach and how they were tackling the problem. We also liked that they were blending coders and the work of a coder within the tool and not positioning it as a replacement. They see the value of the human element and how it best works in the workflow and how it makes them more effective. So that was you know, just their approach, the ease of the tool, and just the way that they've gone about trying to tackle a very complex problem that will continue to be tackled over time.
This would be a good time to announce that on next week's AAPC Social Hour, we will be talking exclusively about AI. Ray, Lori Cox will be joining me, as well as Nick, the CEO of Semantic. So that will be a fun discussion. Ray, this is a great question for you from Charlotte Vaughn. Do you anticipate new certification opportunities that incorporate the data analytics and coding into a specialty?
Absolutely. I think that there's absolute possibility with this. Our first step usually is to release education on complex topics like this. We have an AI in healthcare course that's going to be launching next month to talk about how AI is being used in healthcare, not just from an RCM perspective, but also from a clinical perspective. But one of the things that we do with certification is to identify the job competency of a role. And as coders' roles change and technology is more of an aid, you want to make sure that they can proficiently use that technology. So do I envision a path forward where this could expand or change certification and what we're testing on? Absolutely.
Okay.
Don't have timeline though, so don't start calling us asking when the exam is going to change, because that we don't know yet.
Lila is asking, so far, Semantic is still only working with inpatient coding, correct?
That is
correct.
Okay, all right. Well, there have been so many great comments and questions. We hope we were able to answer your questions here today. Just looking through the comments, we have new AAPC members on here, and Tilly Marth says, I'll be attending my first AAPC meeting on oncology coding next week from Peoria, Illinois. So it's fun to have the diversity of membership here. We have students probably wondering how AI will impact their future careers, as well as our veteran coders thinking, how do I need to adapt? And we are here to help you along that way. So any final comments, Dan and Ray, before we end this broadcast?
I think just a final thought is we're excited about the acquisition. It opens up a lot of new opportunity and potential for us, and we'll be excited to showcase that to the members and to make that technology available to give you the tools that you need to be able to do your jobs more efficiently and to continue moving forward with a big part of what our mission is there. So we're excited about that.
Ray, any thoughts as we wind down?
No, just, stay tuned, keep involved. There's going to be more information about this topic, more insights into Semantic and the tool that it is. So for those of you that are interested, please join us next week when we'll have Nick with us too.
Yes, I am just grabbing the link to that Facebook event right now, and I'm going to drop it into the comments for everybody. So you can have that next week's social hour. Oh, and here it comes. And you can ask to be reminded. If you go to that link, you can ask to be reminded of when that starts. But Dan, Ray, thank you so much for sharing this exciting news with our members. We're looking forward to see how Semantic evolves with AAPC and how the AAPC evolves with AI.
Absolutely.
Thanks, Alex. Thanks, everybody.
Alex.